Life is like walking on a tightrope, and so is the state of your blood. That's a big claim, right? But it's true. Blood thinners, small tablets that are very strong, are really important in keeping this balance for a lot of people. This balance is especially key for our blood system. Our bodies make things naturally that help our blood stick together, stopping too much bleeding when we hurt ourselves. But sometimes, these sticky things can work too much, creating dangerous blood clots. That's where blood thinners step in. These medicines help lower the chance of blood clots, keeping the blood moving smoothly in our veins and pipes. Blood thinners, also known as anticoagulants, are used by millions of people around the globe. In just the United States, it's guessed that almost 10 million people depend on these small tablets every day. And as we get older, the chance of needing blood thinners goes up, making them a regular part of many older people's daily habits. But why are they used so much? The answer is in the many health problems that can raise the risk of blood clots. From heart issues like irregular heartbeat to things like sitting still for too long, these risks become more common as we age. And for many, blood thinners are a key tool in handling these risks. But it's not just about stopping blood clots. Blood thinners can also help stop strokes. By helping to keep the blood moving freely, these medicines can help lower the chance of a stroke, which can happen when a blood clot stops blood getting to the brain. However, like any medicine, blood thinners come with their own risks and problems. Knowing these risks and the possible good things is key for anyone taking these medicines. But let's not get ahead of ourselves. For now, let's be amazed at the power of these small but strong tablets. These small tablets that can protect us from very dangerous health problems. These small tablets that help keep the balance of our blood. These small tablets mean a lot, don't they? But, like other good things, there are dangers too. Let's talk about the possible dangers that can come with blood thinners. These are strong medicines, and while they do a great job at stopping blood clots and protecting against heart attacks and strokes, they also have some downsides. One of the biggest dangers is internal bleeding. This can happen anywhere inside your body, but it's extra worrisome when it happens in your stomach, intestines, or brain. Imagine a garden hose with a tiny hole. The water, like your blood, drips out slowly but steadily. Over time, this can cause big problems. Another danger is a hemorrhagic stroke, which is when a blood vessel in the brain bursts, causing bleeding around it. This kind of stroke happens less often than the other type, the ischemic stroke, but it's usually more deadly. Picture a dam breaking. The sudden rush of water causes lots of trouble. That's like what happens during a hemorrhagic. Then there's the chance of problems with other medicines. Blood thinners cannot mix well with certain drugs, making the blood thinners work too much or not enough. It's like putting two leaders together in a dance. If they're not carefully matched, they could easily step on each other's feet, leading to a messy dance. But don't be scared by these dangers. They can be controlled and reduced. It's all about balance and careful watching. Regular doctor visits, being aware of the signs of internal bleeding, and keeping track of all your medicines can really help keep you safe. So, even though these dangers might seem scary, remember that millions of people use blood thinners every day and live happy, active lives. It's not about being scared, but about being aware. Knowing is power, and understanding these dangers is the first step in controlling them. But let's not forget the big good things from these important medications. Blood thinners are like quiet heroes, always working in the background to keep us safe and well. One of the big plus points is that they help stop heart attacks. They do this by making sure blood clots don't form in our blood vessels, which can stop blood from getting to the heart. Just like that, these medications are important in stopping strokes, a problem that can be really bad. Strokes happen when a blood clot blocks the blood going to the brain. By keeping the blood thin, these medications make sure that this important part of our body gets a steady, non-stop supply of blood. But the good points of blood thinners are not just about the heart and brain, they're also key in stopping blood clots in other body parts. For example, they can help stop deep vein thrombosis, a situation where blood clots form in the deep blood vessels of the body, often in the legs. If not treated, these clots can go to the lungs, causing a very serious condition known as pulmonary embolism. Now, it's important to keep in mind that these good points often beat the bad points for people with certain health problems. This includes people with man-made heart valves, those with certain types of irregular heartbeats, or people who have had a heart attack or stroke in the past. For these people, the good points of taking blood thinners are much bigger than the possible bad points. So, while it's true that blood thinners can have some risks, it's also true that they have many good points. They are a very important tool in our healthcare, helping us fight against some of the common and serious health problems out there. Overall, the use of blood thinners is like balancing on a tightrope, a dance between good points and bad points. But for those who need them, this dance is more about the good points. The good of blood thinners can make a big difference for those who need them. Life is about finding a good right. This is true for everything, even when we talk about blood thinners. Doctors hard to make sure the good effects are more than any risks for each patient. But how do they do this? It all comes down to making things fit each person. We're all different. Our bodies react differently to medicines, our daily routines are not the same, and our health conditions are unique to us. So each patient's treatment plan is made to fit their own needs and situation. Doctors think about many things: age, health, daily habits, and the reason for taking blood thinners, to name a few. Regular checkups are really important in this. These visits let doctors see how well the medicine is working and make any changes needed. It's not a set it and forget it kind of deal. It's an ongoing process that needs careful attention. Taking blood tests is another key of this. They help doctors see how fast blood clots, which can show whether your dosage needs changing. If your blood is too thin, you might bleed too much. If it's too thick, you can get blood clots. It's a careful dance of accuracy and safety. Being on blood thinners might feel like walking on a tightrope sometimes, but remember, you're not alone. Your healthcare team is with you every step of the way, making sure you're safe, cared for, and that the balance is right. It's not just about lowering the risks of blood thinners. It's about making their good effects greater to make your life better. That's the real balance. It's a journey, not a destination, and it's a journey that you and your healthcare team take together. With careful watching, the balance can be kept. So, let's keep talking, let's keep asking, and let's keep working together to find the right balance for you. Because at the end of the day, it's all about having the best life possible, right? And you, the person watching this, have a big job in keeping things balanced. The world of blood thinners is complicated, with dangers and advantages, and it's up to all of us to understand it well. A big part of this is knowing how to look after your health. Taking your medicines as told is very important, and you can't take it lightly. These medicines are strong helpers in fighting serious health problems, but they can also be harmful if not used correctly. It's really important to follow the instructions given by your doctor exactly, making sure you're getting the most from your treatment without putting yourself in danger. Checking for side effects is another big job. We're all different, and our bodies can react differently to the same medicine. If you notice anything strange, don't wait to talk to your doctor. It's always safer to be careful when it comes to your health. Talking with your doctor is also key. Remember, they are your helpers in this, with the knowledge and skills to guide you. If you're worried or have questions about your treatment, don't keep them to yourself. Open, honest talks can make a big change in how well you do. Your job doesn't stop there. Staying informed, being active, and looking after your overall health are also your jobs. This includes eating well, exercising regularly, and managing stress well. In the end, it's all about balance. The balance between the dangers and advantages of blood thinners, the balance between following your treatment and listening to your body, and the balance between relying on your doctor and taking care of your health. Remember, you have the power to keep this balance. It may seem hard at times, but with understanding, hard work, and the right help, you can understand the world of blood thinners and be safe. Your health is up to you.